Around 80% of adults experience lower back pain at some point in their lives. It's one of the most common reasons for a doctor's visit. And now new guidelines from the American College of Physicians say first treatments should be natural, not drugs. Dr. Jonathan Stieber, co-founder of Ortho Manhattan, is an orthopedic surgeon specializing in the spine, and he joins us now. Welcome, Dr. Stieber. So good to see you.
Thank you for having me.
So were you surprised by these new guidelines considering how often opioids are prescribed for back pain?
Not really, actually. We've known for some time that opioids are overprescribed. There's a tremendous opioid epidemic in this country.
So there's more focus now on perhaps eliminating any places where it might not be necessary.
Absolutely.
All right, so let's talk about back pain specifically. Thank you so much for bringing this spine with you. When people have lower back pain, what's going on exactly?
Well, there are a number of factors that can result in low back pain. Most people that come into the doctor's office that present with what we call nonspecific low back pain may have a muscular strain or sprain, may have tweaked a disc or injured a disc in some way. There are joints in the back of the spine that can be injured just like any other joint in the body.
Can you show us where most commonly you see the most injury to the spine?
So certainly. So the spine is a column of bones, and in between these bones we have these intervertebral discs. And the discs are constructed like a jelly donut. They have a harder outside and a softer inside. And depending on your genetic predisposition, everyday wear and tear, maybe some sort of injury, these discs can be injured or even rupture. On the back of the spine, there are a pair of joints at each level. And these are real joints, like your knuckles, that have cartilage and joint fluid and a joint capsule. And so there are a variety of anatomical structures in the spine that can be injured or irritated.
Right. And so there's all kinds of back pain, right? There's chronic pain, there's acute back pain, subacute, right? What are all the differences and what are the treatments that are now recommended for these?
So they break these down really by the duration of symptoms, with acute back pain being back pain that's within 4 weeks, subacute 4 to 12 weeks, and then chronic back pain over 12 weeks.
Right. And so now how are we supposed to treat this pain?
So this is an update on the guidelines that were initially issued by the American College of Physicians in 2007. We're now 10 years later, and they've updated some of their recommendations. You've already alluded to a strong recommendation against using opioids or narcotic medication. They've also looked at the use of acetaminophen or Tylenol, and whereas that had been previously recommended, more recent studies have shown that other anti-inflammatories, such as ibuprofen or naproxen that you might get in your local drugstore, may be more effective.
Maybe more effective. But what about things like yoga and acupuncture and massages and physical therapy? Are these helpful?
So one of the things that they also did in this iteration of their guidelines is looking at some of those alternative therapies. And it does seem that while the evidence is what they would call low-level evidence, is for a moderate effect from things like Tai Chi.
Right. No home runs.
Or yoga.
There are no home runs, but they seem to help a little bit. Is that?
Precisely.
Okay.
Precisely.
So in your practice, I know that you say that you do not commonly prescribe opioids. What recommendations do you give your patients?
Well, for those patients that come in with a non-specific sort of back pain, and I do think it's important to put this in the proper context, that patients that have severe sciatica, pain down their leg, weakness, numbness, other neurologic symptoms,
right,
that's a different thing.
Yeah.
All right.
Yeah.
And similarly, for say an older person who might have osteoporosis, if they have acute onset of pain, that might be resulting from a fracture.
So you should be aware if you have pain that goes down your legs, that could be something more serious, correct?
Certainly.
Are there other symptoms to look out for something more serious?
Well, any sort of neurologic impairment,
okay.
So weakness, numbness,
right.
Any sort of problem going to the bathroom, and
right.
that sort of thing can be serious.
Now, isn't it true that treating back pain can be especially tricky because of its link to certain psychological issues like stress and anxiety?
Absolutely. So I always approach my patients from a biopsychosocial standpoint. So you have the biology of what's going on in the spine. You have what's going on in their life and the stressors in their life and maybe the demands of their particular job or their hobbies, sports, and then the psychology, which can certainly worsen back pain or make it better. And one of the things that they've looked at in these guidelines is the role of certain psychological treatment, which actually can be very effective, especially for chronic back pain.
I happen to know my husband suffered from back pain and he read a book about how it can often be so related to stress that if you just realize that it's related to stress, it can suddenly alleviate a lot of the pain.
So it's absolutely true. At the same time, as a surgeon,
yes.
and these guidelines were written a large part, I think, by primary care and non-operative doctors, sure. There can be very real underlying problems, stress fractures of the spine, herniated disc, structural problems that do have a surgical indication or a remedy.
Right.
And so for those patients who really do have persistent or progressive pain that goes beyond a month, they should consult with a specialist.
Absolutely.
Like an orthopedic spine surgeon or a neurosurgeon.
Absolutely. Now, is the fact that the spine is directly connected to the brain, is that why it is so intensely affected by our psychological states?
Yeah.
Or is that an unknown?
I can't really say.
Yeah.
I do think that pain anywhere in the body can be can be affected by the psychology.
All right, Dr. Jonathan Stieber, thank you so much for that fascinating discussion.
You're very welcome.